Thank you for joining HIP, Health Insurance Personalized. This is Consumer's Doctor on the behalf of Foremost Organization. Today's topic, main stakeholders' needs. Who are the stakeholders and what are their needs in so-called personalized healthcare? When I say personalized healthcare, it is a consumer-driven, patient-centric healthcare. There are several stakeholders in this whole aspect of the healthcare, so-called. We have been talking about healthcare, but we don't come up with the solutions because we have spent almost like $3.7 trillion. In spite of that, we rank 37th among the most advanced countries. I'm talking about America. Spend 3.7 every year. The costs keep going up, and it's becoming less and less affordable, and it is also becoming cost prohibitive, and more and more families are declaring bankruptcies because of inability to pay the bills. So I'll go into few details. If you need to achieve this personalized healthcare through personal care accounts, so-called health savings accounts, there are a few things our House of Representatives, the Congress, has to pass this and facilitate it to the average folks, especially to the impaired, clients, and either economically impaired, physically impaired. So let me go into the details of exactly what each stakeholder needs. Number one stakeholder is consumer, obviously, consumer. Consumer wants coverage of pre-existing conditions. Very important. Coverage for pre-existing conditions. Increased choice. You can't take away the choice. We don't want Canadian system. We don't want British system. We want more choice. We want freedom in healthcare. And we want improved quality at the same time with lower premium, insurance premiums, folks, lower insurance. So consumer is the main stakeholder, and they need pre-existing coverage for pre-existing conditions, increased choice, improved quality, and lower premiums. That will go a long way in achieving that objective. Who is the next stakeholder? We have been talking about this for quite some time. Uninsured. People are uninsured, keeps going higher and higher. That's how the Obamacare got where we are. But still, there are a lot of uninsured folks. There's a lot of people who can't afford the premiums. What does the uninsured want? Guaranteed access. That's what they need. Guaranteed access to affordable coverage. Most of the uninsured needs guaranteed coverage. Who's the third biggest stakeholder? Obviously, hospitals. Hospitals. What do the hospitals want? Minimize the uncompensated care, folks, because hospital emergency rooms are providing uncompensated. Look at the immigration. Right now we've opened the floodgates, and a lot of people are migrating. They don't have any. They to provide a coverage for those folks who are migrating across the border is going to be a challenge. And we want to minimize hospital burden. Hospitals are the big stakeholders. You have to minimize their uncompensated care. That will lower the cost, folks. That will lower the cost. Who is the next big stakeholder? Obviously, we all know doctors. Doctors are the big stakeholders in this healthcare reform. What do they want? Doctors want. Doctors want tort reform. Tort reform. Because we as physicians, I have been there, I've done that. We as physicians, when we practice medicine, we practice defensive medicine in this country. Defensive medicine means unnecessary testing, unnecessary, just to prevent you from being sued. So, tort reform with limited awards. The awards needs to be, limited. So that way our insurance, malpractice insurance premiums will not go up. So we doctors want tort reform and lessen defensive medicine. Lessen defensive medicine. Especially with telehealth, telemedicine. We are diagnosing so many conditions. Some of these folks, they don't need to be seen if we can come to a diagnosis. Most of the one third of the illnesses, one third of the illnesses are psychosomatic, folks. Doctors can make a diagnosis without physical exams. This defensive medicine prevents you from doing that. Defensive medicine wants you to see, but the technology is proving the other way around, folks. Technology is proving the other way around. So doctors need tort reform. Who are the next big stakeholders? No less than our insurers, none other than insurers, who are the big stakeholders. Right now, insurers are the big stakeholders. What do they want? Stabilize private insurance market. Their insurers are looking for private insurance market solutions like personalized healthcare, guaranteed coverage. And also they're looking for is expand client sales. They want more clients. Our insurance companies obviously want more client sales and product offerings. So as insurers look forward to stabilized private insurance market, we need to come with a private insurance market like personalized healthcare, health insurance, risk segmentation. So this is what, to stabilize it, we need to have all those things. Expand the client sales and product offerings. This is what the insurance companies want. They want more clients. Not necessarily healthy, but all the clients. Under you need to segment these clients into different categories like who are well category, at risk category, chronic illness category, and catastrophic. They want more clients so they can, but at the same time, they should be able to provide insurance to all the folks in a privatized insurance market. That's what insurance companies' needs are. Who are the next biggest stakeholders? Obviously, the employers. Employers, large and small, irrespective. Large employers usually are self-insured. They need some reforms in they're self-insured. Whereas small employers, this is where we have been neglecting a lot, folks. Small businesses, small employer groups, they're not able to provide health insurance for their employees. We need to incentivize small employer groups to provide insurance to all the individuals, especially, our economy thrives on small business. So we need to encourage small business employers to have insurance for their employees. So what do their needs? Employers' needs are affordable group health insurance. That's what they need. Affordable group health insurance. Lastly, agents and brokers. Obviously, agents and brokers, when they sell the insurance policies, agents and brokers, they want more commission sales. That's what they need. Agents and brokers want more commission sales in promoting health insurance. They can get it as long as through health savings accounts like personal care accounts, folks. These are the main stakeholders, folks. Again, I will repeat it. There are roughly about 7 to 8 of them. Number one is the consumers want coverage for the pre-existing conditions, increased choice, improved quality, and lower premiums. Number two, uninsured. Guaranteed. Uninsured folks want guaranteed, accessible, affordable insurance. And number three, hospitals. They want to minimize the cost of uncompensated care. Number four, doctors. Tort reform and lessen defensive medicine. Number five, insurers, insurance companies. They want a stabilized private insurance market, expanded client sales and products offerings. Insurance companies, that's what they need. Number six, employers. Employer needs affordable group health insurance, insurance for large and small. And number seven, agents and brokers. More agents and brokers want more commission sales. So these are the main stakeholders, folks. We need to address each one of them, and we can be number one in healthcare as long we fulfill the promise of each stakeholder, folks, through personal care accounts. I'm not advocating any one size fits all approach. One size fits all will never work in healthcare. Let's look into that, folks. Let's have seriously look into personalized healthcare through personal care accounts like health savings accounts, health reimbursement accounts, so consumers can be given a choice and freedom and affordable insurance premium. Thank you for listening. We will see you in the next episode. Goodbye. I love you guys and salute.